Do you have high blood cholesterol or anybody in your family that suffers from high cholesterol level or also called hyperlipidemia? The main questions are: what is hyperlipidemia or high blood cholesterol? Who should get screened? And how do we treat hyperlipidemias? The fat that we eat, they're also called lipids. They're digested and broken down, and then they travel to the blood with the help of special proteins called lipoproteins. There are four types of lipoproteins: chylomicrons, VLDL, LDL, and HDL. The function of these lipoproteins is to carry these lipids in different forms in our blood. So what we do is that we ask for the lipid profile that should be done while fasting, in which it will show us the total cholesterol, which should be less than 200 milligrams per deciliter. Whereas 200 to 239 milligram per deciliter is considered a borderline high. 240 milligram per deciliter or greater is considered high and requires treatment and change of lifestyle. Now, HDL cholesterol is the good cholesterol. Anything above 60 milligrams per deciliter is considered excellent. We need this cholesterol reading to be high. If it is 35 to 45, it is considered borderline, whereas anything less than 40 milligram per deciliter is considered low, and that is not desirable. LDL, or the bad cholesterol, 60 to 130 milligram per deciliter is desirable. 130 to 159 milligrams per deciliter is considered borderline. Here we need to start the lifestyle change, the exercise. Anything above 160 to 189 is considered high, in which treatment is recommended. Another thing our lipid profile will show is a cholesterol HDL ratio. If the ratio's result is 4, it is desirable. 5 is borderline and 6 is high risk for cardiovascular diseases. Triglycerides, less than 150 milligrams per deciliter is considered normal. Mild increase starts when it goes above 150 to 499 milligram per deciliter. A moderate increase is when the reading is between 500 to 886. Anything above 886 milligram per deciliter is considered a very high level of triglycerides that requires treatment. Who should we screen? Patients with known cardiovascular disease, or a family history, or if a patient is less than 50 years old and has a corneal arcus. Another signs are xanthomata or xanthelasmata that are seen around the eyes. These are collections of cholesterol that are seen under the skin. Patient with diabetes mellitus or impaired glucose tolerance. A patient who suffers from hypertension is also considered a high risk. A smoker patient and any patient who has an elevated body mass index. Types of hyperlipidemia. This disease could be common and primary hyperlipidemia, familial hyperlipidemia that runs in the families, secondary hyperlipidemia due to other diseases like Cushing syndrome, nephrotic syndrome, hypothyroidism, or cholestasis. Some patients may have mixed hyperlipidemia. Now let's go to the main point. What is the management for hyperlipidemia? Obviously, lifestyle change comes first. Aim for a BMI of 20 to 25. Diet plays a big role in the management of hyperlipidemia. Try to take high fiber diet. Increase fresh fruits and vegetables. Take omega-3 fatty acid supplements and exercise daily. In case of secondary hyperlipidemia, treat the cause first. When the lipid profile levels are very high, we indicate some medicines. The first line therapy is statins, better taken at night. This decreases the cholesterol synthesis in the liver. The second line therapy is fibrates. These decrease the cholesterol absorption. Hypertriglyceridemia responds best to fibrates, nicotinic acid, and fish oil. Thank you for watching. Stay healthy. Do follow and subscribe. Thank you.